Madam Chair, Excellencies, distinguished delegates, I have the honor to deliver the statement on behalf of the Government of Ghana. Ghana aligns itself with the statement delivered on behalf of the G77, as well as the one delivered by Nigeria on behalf of the African Group. The 1994 International Conference on Population and Development was a groundbreaking conference for sustainable development, placing human rights and dignity at the center of the global development agenda. The ICPD Program of Action and its follow-up commitments have provided direction to population policy and programming over the past 25 years at different levels. As part of the process to review 25 years of implementation of the ICPD Program of Action, national, regional reviews have been undertaken, and this global review crowns the entire process. In the African region, Ghana was privileged to host the conference to review Africa's follow-up commitment to ICPD Plus 25, regional report on 5 years of implementation of the Addis Ababa Declaration on Population and Development in October 2018. Among others, delegates from all over Africa, including civil society organizations, agreed that poverty and inequality still persist in Africa and should be addressed. Reproductive health challenges, including maternal morbidity and mortality, still require urgent attention. Nutrition and early childhood development should receive more attention. Irregular migration of the youth from sub-Saharan Africa should be addressed utilizing innovative approaches. Countries should set up and strengthen institutions that coordinate all population issues, guided by appropriate implementation, monitoring and evaluation mechanisms, and linkages between regional blocs should be used to promote South-South cooperation. As the way forward, countries in the region should remain committed to the outcomes of the regional review and accelerate the implementation of interventions to achieve the objectives and targets of the AADPD and ultimately an improved quality of life for the people. Madam Chair, Ghana reaffirms her commitment to implement global and regional development obligations, including the follow-up commitments and review outcomes of the AADPD, the Agenda 2030, and the AU Agenda 2063. We are fully aware of the overlays in global and regional development agenda, all of which ultimately aim at sustainable development, and the need to integrate the implementation as the surest way of leaving no one behind. In view of this, the government of Ghana has consciously incorporated these commitments into the national development planning processes to accelerate implementation and achievement of targets. The current medium-term development policy 2018-2021, Agenda for Jobs, creating prosperity and equal opportunity for all, has its key policy objectives and strategies linked to specific goals and targets of the Agenda 2030 and AU Agenda 2063. Accordingly, Ghana is implementing a number of interventions to achieve the global objectives of the Program of Action, the AU Agenda 2063 and the Agenda 2030. For instance, in line with harnessing demographic dividend for national development, Ghana is implementing a free senior high school intervention to increase access to secondary education and expansion of technical and vocational education and training. Furthermore, the country has developed and adopted national guidelines for comprehensive sexuality education. These guidelines are to ensure that adolescents are exposed to age-appropriate, scientifically proven, and culturally sensitive comprehensive sexuality education. The guidelines are being used to review the school curricula for in-school training and for out-of-school youth. In addition, there is a piloting of clinical methods of family planning for paid-up members of the National Health Insurance Scheme in 6 districts located in 3 regions of Ghana to make a case for improved access to family planning services. Furthermore, government has taken several initiatives to create jobs for the youth, including the Nation Builders Corps and the Planting for Food and Jobs program, which aim at addressing graduate unemployment, with a focus on public service delivery in areas such as health, education, agric, governance, technology, and domestic revenue mobilization. There are a number of challenges to the implementation of some commitments made by government, as funding remains one of the biggest constraints. In order to overcome the challenge, the President of the Republic of Ghana, His Excellency, Nana Addo Dankwa Akufo-Addo, has drawn up and is leading a Ghana Beyond Aid agenda that emphasizes efficient domestic mobilization to sustain implementation of interventions to achieve national, regional, and global development targets. Notwithstanding this agenda, official development assistance to many developing countries, including Ghana, still remain critical to achieving global commitments. We acknowledge that tracking the implementation of the ICPD program of work and follow-up commitments, as well as other global and regional agenda, requires strong data systems at both national and subnational levels. In addition to the establishment of a Ministry of Monitoring and Evaluation to monitor specific government programs, the National Medium-Term Development Policy, including a clear monitoring and evaluation framework to facilitate quarterly and annual reporting on programs and indicators. The Ghana Statistical Service has already conducted 5 post-independent censuses and is preparing towards conducting the 6th in 2020. The discussions leading up to the next census border on how to collect data on variables that are relevant to tracking progress in national, regional, and global development indicators. Ghana has volunteered as a nation to be assessed on its progress with the SDG under the voluntary national review process. The National Statistics Agency, in collaboration with the Coordinating Agency for National Development, have launched an SDG tracking platform that provides information on specific SDG targets for which Ghana has data and will report on in July this year at the high-level political forum. Information from several national surveys, including the Demographic and Health Survey, the Multiple Indicator Cluster Survey, the Maternal Health Survey, and the Living Standard Survey, have made it possible for Ghana to track and report on many basic indicators, which are in line with the indicators of Agenda 2030 and AU Agenda 2063. In conclusion, Madam Chair, we wish to emphasize the need for strong partnership among government, non-governmental organizations, the private sector, academia, development partners, UN, donors, and other interest groups for the successful implementation of the follow-up commitments and outcomes of the regional reviews, the Agenda 2030 and the AU Agenda 2063. In Ghana, the recent reconstitution and inauguration of the board of the agency responsible for coordinating population issues creates a strong platform for fostering and strengthening partnership among stakeholders to work towards the goals and targets of the Sustainable Development Goals. Finally, Madam Chair, I would like to recognize the strategic and paramount role of UNFPA, who since 1972 have been our most dependable partner in population issues, and from 1994, the implementation of the Program of Action of ICPD. I thank you, Madam Chair.